video. This time I will gonna show you how to perform a balloon tamponade. A balloon technology that is being used to tamponade the postpartum uterus to control postpartum hemorrhage. This involves inserting a rubber or silicone balloon into the uterine cavity, inflating the balloon with normal saline. In a BEMONC facility, an intrauterine balloon can be used to stabilize the patient before referring her to a CEMONC facility. Sit tight, relax, and learn from today's procedure. Assess the woman's status. Assess the client's capability to follow instructions. Gather 2 sterile gloves, povidone iodine, intrafoley catheter, saline solution for irrigation, 50 cc syringe, and prophylactics for easy accessibility. Good day, ma'am. I am Nurse Ange. I will be your nurse for the day. So today, ma'am, we will be doing an emergency management for your postpartum bleeding by making a uterine balloon tamponade to stop the bleeding. I will make a balloon and inflate it into your uterus to stop the bleeding. I want you to take a deep breath and stay still. Explaining the procedure to the client relieves anxiety and apprehension. Ma'am, if you can stand up to urinate to the bathroom, I will assist you. But if you feel dizzy, I can offer you a bedpan or I can insert a catheter that will help you to urinate. Encourage the client to urinate because a full bladder can weaken contractions and delay the separation of placenta. Ma'am, I will assist you to lie down on bed with your legs apart. And I will drape what is not needed to be exposed. Asking the patient to lie down makes easier for us to have visualization. Draping the client provides them their privacy. Ma'am, I will start an IV infusion to restore the blood loss, and I will mix a medication to your IV fluid that will help your uterus to contract. It helps restore blood loss and treat shock. It also keeps the uterus well contracted and stop the bleeding. Now that I'm done washing my hands, I will apply an alcohol. And then I will put an antiseptic solution to the patient's thighs. Now I just put my sterile gloves. This protects you by preventing any accidental contact of a substance that could carry a microorganism through break in your skin. So we will now be checking how extensive the bleeding of our patient. Okay, it's very extensive. Prepare and assemble the UBT kit. Insert the Foley catheter halfway of the condom balloon, leaving a small portion of the balloon beyond the tip of the catheter. Carefully wraps one rubber of ring around the base of the balloon, tying it in exact tight to not loose, but not too tight that it will prevent the inflow of water. Draw normal saline into your syringe, then attach it into the catheter at the opening used to fill the smaller Foley balloon, which is at the top of the catheter. Insert UBT into the bleeding uterus, making sure that it is inserted through the cervical opening and into the uterus and not just on the vagina. Push 15 ml of NSS through the catheter into the Foley balloon to check if there is leakage on the inflated balloon. Tape the catheter to the patient's thigh for gentle traction. Draw another 50 ml of NSS and attach it in a one-way valve of the catheter. Push NSS into the main condom balloon inside the uterus. As the balloon fills with water, it inflates. Repeat this action using as much as water as necessary to stop the bleeding. This usually requires 300 to 500 milliliters of NSS. This pressure stops the bleeding. Connect the drainage port of the catheter to the fluid collecting bag to monitor for the amount of blood loss. After the procedure, I will remove my gloves and wash my hands. Continue to monitor for the vital signs, urine output, fundal height, vaginal bleeding, and amount of blood loss to monitor if the client is experiencing hypovolemic shock. Document the procedure on the nurse's notes. If the bleeding did not subside, you need to refer the client to a CEM-ONC facility.
This is Angelina Itagle, a second-year nursing student at Finma St. Jude College, Manila.